Thanks so much, Kendra. Hi, everybody. I wish I could see you all, but we're in Zoom land. Thank you for joining us today. I really am glad that you're here, and hopefully this talk will be useful to you. So we're going to talk about stressful times, which we've all been through. There's been a pandemic for going on 2 years now, right? And this is something that has impacted the entire world. And how many things really do that, right? So the whole world has been under stress and challenged and been transformed over these past 2 years. And we're going to talk a little bit about how that has impacted us in a stressful way and what we can do about it. And there are things that we can do. But I think, if you told one of us 2 years ago what kind of world we'd be in today, we wouldn't have believed it, right? Things have really changed in a dramatic way. So hopefully, again, by the end of this talk, you will have some ideas about what to do to cope effectively and be able to pinpoint areas where it might be impacting you with stress. There's probably a lot of things we're going to talk about that are not going to be new to you. You're going to know a lot of these things, but one of the repeated themes here is that there's a lot of things that we know, but it doesn't mean we're actually doing them. So we'll come back to that because I think that's a key point. All right, so when the pandemic first hit 2 years ago, we all had to quickly adjust to this oncoming threat. And this was new, right? None of us have lived through a pandemic like this in our lifetime. This is a once in a generation experience. So there's research about what happens when there is a crisis, a large scale crisis, but they're usually studying and looking at things like natural disasters or terrorism episodes, and the way people respond to that, there's an initial stage of shock, right, and confusion and fear, and what's going on. There's never enough information. There's always a need to learn more. What's going on? What is the threat? How do I appraise this? How do I cope? And there's a lot of energy. People mobilize to respond. So if there's a hurricane, when is it coming? What are the wind speeds? Where's it going to hit? Where do we need to evacuate to? Do I need to evacuate? Should I board up windows? All these things happen, right? So people respond in a very mobilized way, and that's appropriate, right? But those kinds of events are what they call bookend events, right? There's a beginning, and then there's an end, and then there's the response after. There's the cleanup, there's the processing psychologically, and then there's the task of getting back on with life, maybe change, but still getting back on with life. But those events are easier in the respect that there is a clear ending, right? The hurricane comes, causes devastation, and leaves. The terrorist explosion happens, and then there's damage, and then you have to respond to that. But it's not something that's ongoing, right? And that's something that's really changed with the pandemic, right? There's more to it than there's no actual second bookend, right? We know when it started, it's very clear, but we never really got to the point where it's over, right? It's going and going. So,
Dr. Behan, might I just ask if you can put your slides into presentation mode? I think they might be a little bit clearer for folks.
Oh, I'm sorry. Yeah, I thought
no worries. So sorry to interrupt. Thank you.
No problem. How's that? Is that better?
There you go.
Okay,
perfect.
Great.
Thank
Sorry
you.
about that.
No
All
worries.
right, so with later coping, right, there's no clear end to this pandemic, right? We've gone through, different phases, right? And I remember about a year ago, there was this sort of sense of optimism, like there's a vaccine, we've gotten 2 doses. Most people, if you're following the science. And there's a sense of, all right, we're coming through this. There's an end in sight, and then comes the next unmanageable variant with Delta, and then we started to deal with Delta. And then there's Omicron. So there's this sense of fatigue that starts to set in, and each new wave, instills another challenge. Like we need to cope again. I need to cope again. There's a new threat, really. What do I have to do with this variant? And what kinds of precautions do I have to take that maybe I wasn't taking before? Do I have to put a mask on now in every place I go to? So these new challenges become tiring and fatiguing, right? So we get tired of coping for such a long period of time, right? And this is a unique problem to this type of stressor. The ongoing nature of it and the lack of a clear finish or where is it going to end is a stressor in itself, right? When we can see the light at the end of the tunnel, we can usually kind of hang in there and get through it till we reach that endpoint. But when it's murky or undefined or endless, that is a challenge. So the cumulative effects of sustained stress become a problem, right? Our mobilization can't stay as high as it does in the beginning. And if you remember in the beginning, there was a lot of energy on coping with this pandemic. Remember the toilet paper shortages, right? And all the Purell in the world was disappeared overnight, pretty much. I mean, people were ready to combat what we need to do. You can find Purell now in the stores, right? There's plenty of toilet paper. Nobody's running around doing these things. There's not that early level of stress. But what we do have is that people are feeling depleted, right? People are starting to feel burnt out. We're seeing higher rates of depression. We're seeing people feeling frustrated, seeing more anger. Every therapist I know is completely booked and really tired because their business is booming. They initially worried, what happens when I don't see people in person? Am I going to even be able to practice online? Is that going to work? And boy, has it worked. I mean, people are not canceling because they need the help and it's convenient to do on Zoom. So there's a lot of therapists out there working really, really hard, putting in extra hours. So also, later coping, the longer this pandemic goes on, the more and more people are touched by the virus itself, either having become sick or having family members become sick. And unfortunately, many of us have lost people to COVID. So it becomes not just a stressor, but a source of grief. And that's also something that gets cumulative. So stress over time is bad for the body. It's bad for us mentally, but also physically, right? We can get all kinds of symptoms that are emerging that aren't necessarily always initially obvious as a connection to the stressor, but they're there. Another thing that we're seeing with people is relationship stress. There's a lot of jokes about it, but it's real. People who quarantine together for months on end without a lot of ability to get out, to be around other people, to have even to go to work for many people. They found being with their loved ones all the time stressful, right? And it became a tax on couples. It became a tax on families. Children who normally went off to school, parents would go off to work. There was a nice little break from each other where people got to do other things and come back and then reconnect. But when you're together all the time, people got on each other's nerves. There was much more conflicts. There was high rates of domestic violence. Parents who are dealing with children who are at home all the time and having the stress of dealing with managing schoolwork and homeschooling if it was virtual, while also trying to manage a household and work. Lots of stress there. The other thing that happened is that there's been a curtailment of the things that we all typically do to reduce stress, like going to the movies. How many of you have been to a movie theater, in the last 2 years? Maybe a few of you have started to go back. They're opening up again, but it used to be a regular part of life for many people, or going out to eat, or going to a concert, traveling on a plane. Like a lot of those things have been curtailed. Certainly for all for a period of time, and for most for the last 2 years. That's a problem, right? Life is stressful before the pandemic, and when we had things that we could do to decrease that stress, they were essential, and that was taken at a time when we needed them the most. A lot of people are coping with higher rates of substance abuse. I mean, that's been a real issue. people, one of the things people turn to, unfortunately, when they're stressed is alcohol and or other drugs, which, to some degree gives a form of escape, but has side effects, right? Behavioral and physical dependence, psychological impact, loss of functioning within roles. So these are things that we need to be really careful about. All right, so what kinds of impact has it had, right? So physical health, right? Stress over time causes our health to decline, right? It has its hand in all kinds of illnesses, from heart disease to cognitive decline to digestive tract illnesses. I mean, there's stress is very toxic to the body, and sustained stress is even worse. There's been lots of loss and grief, right? Almost over 800,000 deaths in this country in the last 2 years from this illness. That's more than any other type of disease process, more than cancer, heart disease, probably combined. So lots of grief, lots of loss. Again, that's hard to do during a regular time, but loss and grief during COVID meant some of our normal rituals weren't able to be practiced, right? We weren't able to have, viewings and services where people got together to grieve together, to go to a funeral, to go to a viewing, where you can share grief and talk and remember the person. Those rituals are important, right? That is how we grieve and how we get through it together. And when those opportunities for connection with another person are taken away, the grieving is altered, right? It's more impactful. Like I said before, lots of family stress, career and financial impact. Lots of people have been, experiencing a tremendous hardship from the pandemic, right? They've lost their work, they've lost they've lost income, and that's, all of us, very few of us are not in trouble if we miss a few paychecks, right? You try going 2 or 3 months without income, and most people are in pretty bad shape, right? And that's when you're doing well. And if you were on the edge before the pandemic came and you lost your work, you were in straight out financial crisis. The other thing that's we're going to talk about in a little bit is social connection. That is one of the bigger stressors that's come out of the pandemic, and it's unique to the pandemic because it's the need to isolate and quarantine has taken that away. And social connection is one of our best go-tos in terms of coping with stress. Our roles and routines have been altered, right? How many of you have the same routine now that you did 2 years ago, right? It's very few, right? In terms of just what you did out in the world, what your day looked like, it's been altered. And routine is something that is a mitigator of stress, right? It's predictable. We know what we're doing when, we know how the week is going to unfold, we know what our work day is going to look like, and we don't have to think about it. But with things altered and challenged, what are the restrictions this week, and what kind of regulations are being rolled out in my area, that I need to know about? These are all things that are really challenging. A decreased sense of security. This is Maslow's basic hierarchy, right? A sense of safety is required to be healthy. If we're worried about perpetual threats, our body, our stress level, and our body is on high alert, right? We're in the fight or flight mode, and that becomes toxic to the body over time. And the pandemic has become a source of stress and threat. Again, another topic, not for this discussion today so much, but there's also tremendous amounts of division on how to respond to the pandemic, in terms of vaccines and mask wearing and isolation, and should we open up or not open up? And that's adding a new level of stress and contention to our discourse, and which again is adding to our stress. So there's so many things just piling the stress on top of ourselves. And I think most people don't see that, right? Because we cope, we get on with our day, we take care of what we need to do, we habituate to this level of stress. Doesn't mean it's not there, right? And I think that's the old saying, analogy where the way to boil a frog is to turn the water up, the heat on the water up slowly, so it doesn't realize that eventually it's in boiling water, because if you throw it into a boiling pot, it jumps out. we've been slowly having the heat turned up over these last 2 years. And it has a mental health impact. And I think that's one of the things that I want to talk about now, because it's been pervasive. So we're seeing a real hit on our collective mental health. Prior to the pandemic, the rate of diagnosable mental disorders in the US population was about 26% of us, right, at any one time. 26% of us could be diagnosed with a mental disorder based on the DSM-5 criteria. I'm sure that's higher now, right? If you have 2 years of threat added on to that, it's going to exacerbate all kinds of things. So we're seeing higher rates of depression, right? We're seeing higher rates of anxiety. Isolation is huge, and that's a real problem. Isolation is a real problem. One of the things that is, sort of an emerging awareness is that loneliness is incredibly toxic to the human animal. We are social creatures, and when people are lonely over, I'm not talking about like, for an afternoon, but like perpetually lonely, feeling unconnected to other people, it has its hand in all kinds of physical illnesses and mental illnesses. And there's higher rates of heart disease, higher rates of dementia and cognitive decline, higher rates of various GI disorders. So the loneliness, is something that we need to perpetually keep an eye on. As mental health professionals, we always are looking for a person's level of social connection, and is it sufficient? And if it's not, that's job one. We need to have supports put into a person's place. Now, again, with the pandemic, it literally forced us to isolate from loved ones. I mean, many of us weren't able to see elderly relatives out of fear of bringing a deadly disease to them, which is smart, but at the same time, that person is not getting, the connection with others the way they do. So we'll come back to that a little bit, but the isolation is huge. Insomnia, that sounds maybe mild on this list, but it's not. When people aren't sleeping, it impacts their functioning in all their roles. So it's a problem. We talked about relational conflict, generalized distrust and cynicism, and we'll talk a little bit about that in a minute, and higher levels of substance abuse. So it's something there's been a pervasive exacerbation of many mental conditions that we are dealing with and will be dealing with for a while. Some populations have also been hit even harder, right? And this is where we're going. So those who have dealt firsthand with illness and or loss or sustained illness, the long COVID symptoms, those people are clearly impacted over time. Communities of color are disproportionately impacted by the pandemic, with less opportunity for access to quality health care, often less access to employment, losing employment more readily, less opportunity for education about pandemic mitigation efforts. So, it's pretty well documented that lower income and communities of color have been disproportionately impacted with higher rates of infection and more sequelae from that. Those who lost income and employment, again, devastating, right? Losing childcare, that's, we're, as a culture, we don't do a great job with good childcare, which is economically a drag on our economy. But parents count on school, right, to just have their kids in school so they can do other things like work. Or if you're paying for childcare and then your childcare closes down because of COVID, all of a sudden you have a job and you have children who need childcare. How do you reconcile them, right? So it put a lot of families in crisis. Those who are already struggling with physical or mental or economic problems before the pandemic, the pandemic comes along and makes everything even harder. So, that they are totally caught unaware, but challenged in a very high way. People who don't have health care or lost their health care, again, pretty obvious. And then finally, people who are working on the front lines. And I think a lot of you are probably healthcare professionals, from what I understand. This has been, a heroic and often unsung effort on your part to do your part to take care of people for a very long time, right? In often contentious situations. So healthcare workers have dealt with prolonged stress, right? They go in every day, and I have family members in healthcare. I've worked in healthcare. I know what's happening. Right? They're long, hard days. Especially if you're dealing with in a hospital setting where you're dealing with COVID patients. There's a lot of sadness, right? There's a lot of loss. There's a lot of restriction. There's a lot of frustration. There's a lot of staffing issues. There's more work and not enough people. The conditions in many healthcare settings are really, really troubling right now. Resources are low. There's a lot of pressure, though, right, to keep performing. There's a pandemic. We need you. Show up. Do your part. Take care of people. And that taps into every professional's sense of duty, which is admirable, but it's also tiring and exhausting and not inexhaustible, right? So that becomes a real stress. A lot of healthcare professionals have had sacrifices within their family, not seeing their family as much, maybe needing to isolate from their family for periods of time, coming home devastated from work and then not being able to be with their family the way they'd like to be. So they've taken a personal toll on this as well. And just burnout, right? And feeling sad and feeling fatigued. So people like healthcare professionals, teachers, people on the front lines have really been doing heroic work, often unsung, and have really paid the price here over time. So, all right, enough of the doom and gloom. What do we do about this? How do we cope? What are we going to do to make this time in the pandemic less onerous and get through it? So one of the things to do is to practice self-care. Now, everybody's heard the term self-care. Everybody knows about it, and there's no big, revelation here. But the term deliberately is in there because this is the kind of thing that most people do not do deliberately. It happens by default, maybe, maybe they do some things that are good for them, but they're not consciously spending time thinking, what do I need to do to take good care of myself? And that's a problem. Right, that's a real problem because if you can't keep the saw sharp, if you can't refuel the tank, you're not going to do too well. I was meeting with a couple people who were not American a few weeks ago, and we were talking about various differences in the culture, and they said to me like, what's with you Americans and your vacations? And I'm like, what do you mean? And like, you don't really take much vacation. You don't get much. Like they said, you only get like 2 weeks, most of you. Is that right? I'm like, yeah, that's pretty standard. And they're like, yeah, that seems odd to us. Like, we usually get about a month or maybe 6 weeks. And I had to tell them, like, there's a lot of research that says most Americans don't even take the vacation time that they're allotted. They leave days on the table every year. So there's a culture here about working hard and getting the job done and taking care of everything. And I'll be kept second, right? I don't really need to step up and become a factor in taking care of myself. And that's a problem. So let's talk a little bit more about that. So what does this look like? Obvious, right? Eating well, and look, all things in moderation, including moderation, have some pizza, have a piece of cake, once in a while, it's all good, right? That's actually good, joyous stuff. But a good, healthy diet will pay you back. Exercise. Again, no big news flash here, but the research support for what exercise does for the human body is just settled science. There's so much about it in terms of mental health, in terms of physical health. It can't be beat. So everybody should be doing some kind of regular exercise, and it doesn't have to be pounding the weights in the gym, right? It could be just good brisk walking or whatever fits your capabilities and lifestyle. That's important. So, but exercise should be something that you do. And now, if you go to a gym and you haven't been back to a gym because of the pandemic, right? There's other ways to do this. I know for me, I thank God I had a dog during the pandemic. early days because I wound up walking miles with this dog and who was happy as anything because it was a way to get out of the house and do things. Sleep, again, this is one of those things we all know about, but the research on this, again, is pretty resounding that getting a good night's sleep pays you back in terms of longevity of life, less disease and illness, a better mental health, a better relational abilities, better performance at work. So, if you cheat and spend an extra hour or two watching Netflix or doing something fun or even working, and you don't get that sleep, you pay the next day, and then you pay the next day, and then you pay in the long term. So prioritizing sleep, good sleep hygiene, and it's another talk, but what do you need to do to be able to sleep a good amount of sleep that your body typically requires? There's some variation there, but that should be something we should be paying attention to. And we all know it. Like if you think about when you don't get a good night's sleep and you're clear about that, are you at your best the next day? Probably not. So steady, good amount of sleep. Getting out into nature, right? Getting into the world. And I don't mean necessarily, heading out to the beach or the mountains all the time. That's not always realistic, but literally just getting outside, noticing the world around you, noticing the sky, noticing the warmth of the sun, or noticing a beautiful tree. Vitamin N is called sometimes, like nature is restorative. It takes us away from some of our daily stressors. It can be a stress reliever. So, and that could be just walking around your block or you're walking in your neighborhood, but just getting out of your home in a non-purposeful way and tuning into nature. One of the things that's been shown to be very helpful with stress. Breathing, right? And mindfulness. So breathing, we're all doing it all the time, right? We're all doing it. But if you take your breathing and you slow it down into a deep diaphragmatic breathing in a slow rate, the body relaxes. It just does, right? It's a physiological thing. You don't have to choose anything. You just have to decide, I'm going to breathe slower for the next minute, right? You can do that at a red light. You can do that at your desk at work. You can do that when you know something stressful is going to come up. Take a minute, breathe slowly and deeply. There's a lot of breathing exercises out there. Find one that you like and do it. The other thing is mindfulness. Again, tons of research. This is not alternative or anything like that anymore. Mindfulness is a practice of simply tuning into the moment without judgment and not thinking forward or back, right? Our minds are very active. They jump forward, they jump back. What am I going to do next? What happened there before? And it's a constant hamster wheel that's going on. And if we can slow that down and really just tune into the moment periodically, even throughout the day, even for a minute or two at a time, there's a physiological and psychological reset that can take place. So if you haven't learned mindfulness or haven't practiced it, it's worth checking out. There's way too much research to not be giving it a chance. And if you have done it, but you're not doing it now because you're too busy, you're not too busy. Self-compassion, and we'll talk about this in a little bit, but a lot of people are really tough on themselves, right? They're harder on themselves than anybody else. And that is not good, right? We know that the best way to motivate people is with positive reinforcement, right? That's how we should be raising children. That's how we should be training animals. That's how we should be working with our colleagues. So good, positive reinforcement, respect, understanding people's strengths. That's what makes people work hard. What makes people feel seen. That's what makes people feel validated and cared for. So why not turn that inward? Right? We need to do that for ourselves as well. If you are tough on yourself, and we'll come back to that in a little bit, that's a problem, right? So you need to see what you're doing well. You need to appreciate your strengths. You need to be aware that you're a good person doing your best. And if you have that compassionate voice that you use towards your loved ones, turn towards yourself, you're doing okay. Same, just what I said there. So other coping, maintain your social connections. Again, not so easy during a pandemic when we're told, not necessarily to have a lot of connection with other people, literal connection. I mean, thank goodness for Zoom, that did help. But family support has been, there's some new research coming out about what really has been helping people get through the pandemic, and family support is really jumping out ahead of the pack. one of the most impactful coping strategies you can have. Just having and allowing support from those you love and those around you and those you care for. Really, really important. So how does that happen? It doesn't just necessarily always happen, magically, right? Sometimes we have to initiate our social connection. So it's making a point to call your sister, more often, or do a Zoom, meeting with friends of yours from high school, and initiating those things that don't happen. And a lot of people did, right? They had book clubs, right? But they couldn't meet as a book club, so now they start meeting on Zoom, right? Perfect, right? So, but make these social connections happen. It's with family, it's with friends, it's with people you enjoy being with, it's with people with like interests, but be proactive on that, because those social connections pay you back a lot, and we need this now. So you got to be creative in how you make that happen. Zoom has been helpful. Meet with people outside if you don't want to meet with people inside. Take walks together. Play tennis. Do things that are outside and safe. Go to places where you feel like it's safe, where people are vaccinated or mask wearing. More and more people are starting to go back out to restaurants and concerts and things. You do things in a mindful, safe way, but start to look for those social connections. One of the best things for the human being that we know. And we talked about loneliness. Loneliness is super, super toxic. We need to avoid that. If you have a loved one who's lonely, that's a problem, right? You need to find ways for them to have connection. And that could be, sometimes it's literally a pet, right? Somebody who has a cat or a dog that they love, they don't feel so isolated. Awesome, but loneliness and isolation needs to be addressed. It should not be ignored, or it will be corrosive. All right, other effective coping. Set limits on the news, right? This is a problem, right? The news tends to have a very sensationalistic, pessimistic view of the world, right? They want to grab eyeballs and ears, and they want to make you listen. So, you can turn on the 6:30 news from any major network, and they're hyping things like new rates of COVID sweeping in your city, and there's this sense of be afraid, be aware, be on alert, and woven into that drama is some information that you probably would want to know and probably need to know to make good decisions for yourself. But make decisions on how you're going to take that information in. Sometimes broadcast media in particular isn't necessarily your best friend, especially if you're finding yourself upset with media. You want to avoid the extra drama. So find ways to get your news, maybe from cooler sources, right? Reading it at your pace, from objective news sources, things like that. That's something that can help. Unwind, have some fun, right? Remember, fun. So seek out and do some creative things. Again, this is where you have to be proactive. Fun isn't going to necessarily come knock on your door and pull you outside and make you do something, right? We have to deputize ourselves to say, it's okay for me to do things that are enjoyable. In fact, it's a really good thing for me to do. If you were getting surgery, right, and the surgeon walks into your room and they ask how you are, and you tell them, and then you happen to ask them how they are, and they say, well, I'm pretty tired. I've been doing lots and lots of surgeries. I haven't really been seeing my friends very much or doing anything fun. I haven't had any RR. I'm not really sleeping that well because I'm so busy working all the time. So I'll see you on the table, and then they walk out. Like, you're not going to feel too good about that interaction. You would rather your surgeon say, I've been keeping a balanced workload. I've been enjoying my life. I have been spending time with my family. I have a great dog, and I'm feeling really energized to do your surgery today. That's what you want to hear them say. That's what we want to be doing for ourselves. So don't be the typical all work, no play mentality. That doesn't work in the long run. That's how you burn out. That's how you get stress-related illnesses. Another thing that's been shown to provide coping and also correlated highly with happiness in life is a sense of purpose. Doing something that you feel is meaningful. And if you're lucky enough to have employment that you find meaningful, that can be a magical way to take care of this, right? If you're spending your days doing something that you feel makes a difference, and it could be anything, right? It's a personal relation to your work. It's not what anybody else would lay on that. So if you're feeling a sense of purpose in your work, fine. A lot of people find purpose outside their employment, though. They do volunteer work, or they work with their family, or they have ways where they're doing something they feel makes a difference. If you have that, that means you're probably happier. Most people think they're going to be happy by getting lots of nice things, not necessarily materialistic things tend not to have a connection to sustained happiness, but purpose does. So challenge yourself, learn something new. Helping others. The best way to help others is not through usually labor. It's through good listening and empathy, especially people who are struggling. Try that. Empathy and listening are pretty powerful forces in the world. And things that help you feel accomplished. All right. So another thing is to choose your mindset. Acceptance. Acceptance is, sounds nice, right? It's hard to do. It's easy to accept when things are good and easy, right? But when you're going through a challenging time, acceptance means accepting something you don't want to accept straight out. But there's a certain embracing of reality. And a lot of times we stay upset and angry and in a bad place when we can't accept the reality of a bad situation. And sometimes we're in bad situations. So if you're able to allow that to be and get into a now what mindset, that's liberating, it's freeing. So it's a state of mind. Allow it to be. Don't like it, don't want it, not happy with it, but it is what it is. What do I do now? Right? That takes you're fighting down to a level where you can be effective rather than fighting something that you can't change. When people don't accept something, they ruminate, they chew on it, they think about it over and over. So the problem is churning in them and really pretty toxic, right? And the negative emotions stay, and they set up camp, and a person becomes difficult to live with. They become their life experience is really impacted. So accepting and pivoting is a great thing to do when and if you can do it. Again, another thing from the research is gratitude. This is a huge one, this is not just some little trite thing to do. There's a lot of solid research about having gratitude, changing the way your subjective experience in life is. So you can have gratitude about all kinds of things. The food that you eat, every meal that you get, you could be thankful that you have that meal. You can be thankful on how good it tastes, or or the fact that you even have it. Your health, if you have good health, or one of the ways to help with having bad health is to notice what parts of you are still in good health, right? Like, all right, I have a bad knee. My knee is really killing me. I'm going to maybe need to get PT for it, something like that. But you know what? My other knee's good. Or my elbows and my shoulders are fine, or that injury I had last year is gone. Like, being able to tune into what is good instead of just what is bad has been really helpful. Noticing who in your life you appreciate, all awesome. Noticing what you've done. If you're doing good work, if you're making a difference in people's lives, take a moment to step back and appreciate all that you're doing that's special, and all you're doing that is changing lives. That's important to take stock in and own that. It's not about ego, it's about a sense of accomplishment. So let's try that. Let's try. I'm going to give you about 30 seconds. I want you to just think about one, maybe two things that you're grateful for in your life, and just think about them and about how you are grateful of those things, and just contemplate that. And let's see how you're feeling at the end of those 30 seconds. So let's take 30 seconds and think about one or two things that you are deeply grateful for. Okay. I bet you feel a little better, right? Gratitude has been shown to be a catalyst for reversing negative emotions and helping more positive emotions set up camp in your body. So you can do this every day. You can do a gratitude journal. You can take moments of gratitude. You can, a nice thing to do is with families, sit down to dinner together and everybody say one thing that they're grateful for that day. It sounds a little corny at first, but it really is a good thing to do. It changes the chemistry in your brain. It changes your attitude. So gratefulness, and it's free. You can do it anytime you want. Optimism and hope. Hope is energizing. When there's no hope, there's no energy to move forward and work and fight and deal with things. So we need to have hope. This too shall pass, right? Finding ways to be hopeful in a tough situation. And it's not pie in the sky, it's all going to be great, but realistic hope, realistic optimism. And it counteracts our normal sort of fight or flight coping mechanism. So instilling some hope. These three things, acceptance, gratitude, and optimism and hope are powerful, powerful ways to change your mindset. Another thing is to look at how you talk to yourself. That little voice in your head that runs all day long that you don't really think is a voice, you just think it's reality, is actually you putting your spin on reality, right? So we talk to ourselves and we have an inner dialogue, and how you talk to yourself and the words you choose and the tone that you take is very powerful. So one of the things to do, and often we do this in therapy, is stepping back and taking ownership and authorship of that voice rather than letting it run on autopilot, especially if it's negative, negative towards you or negative towards the world. So you want to try to keep things positive and factual, not phony positive, but realistically positive. And you want to use calming statements, right? You want to, sometimes if you're upset, you want to deliberately start to run some calming statements through that brain of yours to make a deterrent to the negative thinking that can just set up camp and run rampant over your experience. And it's never good, right? So you got the little angel, the little devil on the shoulder. If you only have the little devil yelling things about how bad things are, how bad you are, how bad it's going to be, and that's all you're hearing, it's going to impact you on every level, right? Not healthy at all. All right, so if your own coping efforts are not enough, you're working to be deliberately taking care of yourself, you're deliberately dealing with skills and activities to try to stay as healthy and happy as you can, and it's not working, that happens to all of us. There's no shame in that, right? Life is hard. Things happen. We are in times that are unprecedented right now. And we all go through times in our lives where we really do need to reach out. And that's a problem when people don't reach out and not knowing when they need to reach out, or feeling like they're going to be a burden, or feeling like it's shameful or embarrassing. You got to throw those notions out the window, right? Reaching out when you need help is super smart. And that could be done in different ways. You can reach out to loved ones, friends, clergy, or professionals. Right? So that's what we're going to talk about, is reaching out to professionals. So when self-care is not enough, when you want to do psychotherapy, right? That can be an awesome way to pivot when you've been stuck. So if you notice that you're staying in fear, or you're feeling anxious all the time, or your level of depression and hopelessness is high and sustained, your days are dark, or other psychosocial symptoms, there's people who know how to help you with this. These are very, very treatable conditions. There's a lot there. If you're not meeting your roles, if you're not functioning well within your relationships or at work, or things that you need to do, that could be a sign that you need to get somebody on your team to help you make some changes. If the losses are mounting, right, and you're not coping with them, like I said earlier, grieving is different now. If you're having physical symptoms, again, another reason. So the question then becomes, does psychotherapy work? Isn't that just talking to somebody in an office? What are they going to do? They're just getting paid for it, and it may not help. The research on psychotherapy is pretty resounding that it's a very effective modality, more effective than a lot of physical interventions that get tested, or drugs out there that are widely used and accepted. It can be incredibly effective. Now, will it always be effective for every person, every situation? Of course not. But the track record is very, very strong. So yes, it's well supported by research. So if you decide you're going to get some therapy, smart, do it. it's become a much more common part of society. So who do you go see? Who do I see? Well, there's a lot of different people who can do therapy. Now, the one thing to be careful about is that anybody can call themselves a therapist, right? So you want to be careful that you're not just seeing somebody who's a self-appointed therapist. You want to see somebody who's licensed and who has at least a master's degree in a discipline that teaches them how to be a therapist or a counselor. So that would be psychologists, social workers, or licensed professional counselors in New Jersey. So you want to make sure that they have a license. Really, really important. What about experience in advanced training? How important is that? Do you want to see somebody who's been in practice for 25 years? Well, the research says not really, right? The longer a person's been doing it doesn't mean they get better and better and better and better. There's other things you should be looking for in terms of who's going to be really good. And experience, oddly enough, is not one of them. You could have a lot of people who've been doing this a long time and they're just not all that good. So if it's not experience, and it doesn't really matter what profession I see, because they all, in terms of the outcomes, psychologists don't seem to do any better than social workers or counselors, and vice versa. So what do you look for in a therapist? Most people will tell you this, and it's true. The relationship is huge. Think about this. If you are, how special is it to be in a relationship with somebody who is there for you, who's there to really fully listen to you, to care about you, to understand you, to support you, to see what's good in you, to listen to your toughest experiences and your deepest shames without judgment. And it's a one-way street. You don't have to give them or take care of them. They're there to be there for you. If you can create that kind of relationship where it's genuine and strong, it's a pretty special thing in this world. We don't get that very easily. So a therapeutic relationship is something that's very, very curative. There's something else called the therapeutic alliance, and this is where it's a therapeutic relationship, but there's also more to it. The alliance is a sense of connection with that therapist about where we're going with this therapy. That there's a goal, and we're gonna make progress towards this goal, and we're gonna figure out specific ways that we're going to do this. So there's a sense of teamwork and direction that gets developed within the therapy space that is vital. And the therapeutic alliance has been studied a lot, more than anything really, in terms of psychotherapy effectiveness. And if it's strong, the therapy is probably going to do a good job for you. Now, there's a lot of therapy that goes on out there, and I hate to say this because I love psychotherapy and I love psychotherapists, but there's a lot of psychotherapy that has a good relationship but without an alliance, right? And I call that how's it going therapy. Right? And people go in, they see their therapist, they care about each other, they have interesting conversations, but there's no arc, there's no direction. It's sort of talking about whatever came up that week. And that doesn't really create change for people in the way that they really need it without having a real sense of direction. So you want to find a therapist who's going to not only connect with you, but also help you get on a path. The other thing is personal qualities of the therapist. These are the things that really make a difference. Who is going to be, amazing? Who's going to be, I guess the best way to think about this is to say, is to ask around, like, who's amazing in this area? Who do people really like? Who do people keep going back to? I wouldn't get too caught up in what theory they have, or where their license is, or how old they are. You want to find people therapists who people really think are just great, who really relate well, who can connect with people, who seem caring and genuine and warm and capable and smart. So those qualities, those human qualities, more than their professional qualities, are what the research show really make a difference. That people who can connect well with people. So you want them to be empathetic, warm, engaging, and able to see you, not just a cerebral expert, but somebody who's going to really get into your life in a way that you feel safe and supported. So the research, this is what they find. And they also adapt the treatment to your needs. They're not going to just tell you how to do their approach. They're going to really try to come up with some strategies that make sense to you. And they take feedback from you. That's also very important. Therapists who don't listen to their clients and don't listen when things aren't going well, or they're doing something that doesn't make sense, or they don't like, If they don't have a voice, the client doesn't have a voice, it doesn't usually end well. All right, so I'm going to keep going for time's sake. And the other thing that really makes a difference is motivation to change, right? But it's not the therapist's motivation, it's your motivation. If you're not motivated, then the therapy doesn't work. So the client really has to bring some energy to the therapy in order for it to be powerful. So how do you find a good therapist? Ask around, ask your doctor, ask your friends, ask people you know who have been to therapy. Who's good? That's what you want to know. Who has the longest waiting list? How do I get in to see them? You want to find people who have that reputation. Then you interview them. You talk to them. You don't just because they have a website or people said they were good. You want to try to talk to them a little bit on the phone and find out if it feels like you want to talk more to this person. And if you don't like them on the first phone call, you might want to keep looking. Look at their website. What's their voice like? What do they look like? What is their tone? How do they present themselves? Trust your gut there. And the main thing I say to people, give it a few sessions, right? Not every therapist is going to click with every client and vice versa. And there's no shame in that. No two human beings are always going to work like Legos. Sometimes you find a good therapist who's not good for you. That's okay. It really is. And you'll know usually after 2 or 3 or even 1 session, we're just not going to click. And what really hurts me is when I see somebody who needs therapy and I'll ask them about it. And they'll say, "Oh, I tried therapy, it doesn't work for me." And I'll probe a little bit. And usually it was a bad click with a therapist. And they concluded it must be me or therapy doesn't work. And it's lost to them forever. And that's a mistake. So if it's not working, the therapist usually will know it and you'll know it. And you might have to just invest in finding another person, which is a pain, but still worth the trouble in the long run. All right. And then finally, barriers to accessing therapy. What gets in the way? Stigma, right? Still, there's a stigma externally about, oh, you have to be crazy to go get therapy. It's just old thinking, right? It's almost like, think about it like if you broke a bone in your body and you're like, I don't want anybody to know I have a broken leg, I can't go see a doctor. That would make no sense. If life is more complicated than your leg, let's face it, there's a lot of things that can go wrong, a lot of challenges, life is hard. So having somebody on your team to help you deal with those stressors makes perfect sense. So there's external stigma and our own internalized stigma about therapy. And we want to try to kind of put that out the pasture because it doesn't help. Insurance, cost, it can be expensive. Sometimes it's hard with insurance companies and finding the right person and will my insurance pay for it? It's a mess, right? And it's an embarrassment because it should be a lot easier to get in to see a therapist, but insurance gets in the way a lot. And that's a barrier, sorry to say. And then, don't worry about it being virtual or in person. Therapy has been working just fine for people over virtual means. So that you don't have to get in there and see a person in person. That will come back, and it is coming back. Lots of people are starting to see people in person when they're comfortable with it. And then again, your level of motivation. You have to be willing to show up and work at it, and you'll get something out of it. All right, we're close to the end here. Let's make some time for questions. I guess what you do is type them into the Q&A.
Sorry. All right. Thank you, Dr. Meehan, for such a wonderful presentation.
Sure.
All of the information you provided was great, from self-care and, ways to get help during these stressful times. So we do have some questions here. The first question I have is, can you speak to the impact of the pandemic stress on GI issues? Any strategies?
There's no special strategies for GI issues alone. That's just one of the areas of the body where stress likes to reside, right? And there's other disease properties that can be impacting the GI that are apart from stress, but nobody's going to tell you that stress doesn't have its hand in exacerbating them or even being an initial cause. So the answer there is take care of stress in general, and then consult a physician in terms of what you need to do in terms of diet, and medications to deal with the GI issues. But basically, just stress has its hand in a lot of areas of the body, and the GI tract is one of the more famous ones.
Thank you for that. What do you see as the role of professional organizations in supporting healthcare personnel in these tough times?
Yeah, they should be having your back, right? Professional organizations should be advocating in terms of resources, in terms of staffing issues, in terms of self-care like this, in terms of supporting people who are having economic issues, from their work situation. In healthcare in particular, I mean, the staffing issue is a problem, right? And also stress, like I talked about earlier, that just the unrelenting stress of dealing with work during a pandemic is vital. So I know the National Association of Social Workers has been doing a lot, and I would assume other professional associations are on the radar screen. But if they're not, let them know that you need them to represent you. This is not a business as usual time at all.
Great. Can you speak about longer term effects of chronic stress?
Yeah, chronic stress, again, it has its hand in disorders, right? It can impact, even the longevity of a person's life. It's that dire. I mean, stress is a real enemy, and we tend to acclimate to it and think, well, life is stressful, I have to live with it. And you don't, right? You're never going to be stress-free, but you need to be stress-aware, right? And how much stress are you carrying? If you're finding at the end of the day that your jaw is sore, it's because you gritted your teeth all day, right?
Mm-hmm.
If you are, waking up or not getting the sleep, waking up too early or not getting sleep right, it's probably because stress has got its hand in there. So instead of enduring that or trying to numb out, find the source and go after the stress. And again, it's about being proactive. And I think way too many of us try to push past stress because we have work to do and families to take care of and all of that. And we're not targeting the stress in our self-care directly. And it has to be a more intentional process.
Okay. Are there any statistics available indicating percentage of U.S. population affected since record of first COVID-19 case?
I'm sorry, I missed the percentage of the U.S. population that was?
Yes. Are there any statistics available indicating percentage of U.S. population affected since record of first COVID-19 case?
Affected in which way? I mean, it's, we've all been affected, and some of us worse than others, right? And again, that involves, pre-morbid conditions that a person had before the pandemic started. And level of impact, in terms of financial, psychological, social, economic, right? So it's highly variable, but I don't know anybody who hasn't been impacted in some way, right? And probably on the planet, unless there's some niche areas where people haven't encountered other human beings in 2 years, this is a global phenomenon.
Right. Do you have suggestions for how to establish boundaries from those who thrive in drama/high stress mindsets?
Yeah, well, yeah, that's a tough one, right? Because people have different styles and boundaries. I mean, the fact that you even bring up the term boundaries is very smart, right? And you do that without anger and without resentment. When you try to set boundaries in anger, it just creates problems, right? So you do it, if you can, you might want to just have a conversation with the person like, look, we're very different in some ways. We need to work out a way to be near each other and with each other that's going to be more functional, and getting it out on the table in a calm, problem-solving kind of attitude rather than an accusatory one. Usually these things don't go well because people handle it when they're mad and angry, and that just creates polarization. But if you can create a space where you're actually problem-solving and accepting that, like, we're very different, let's make it work.
All right, and I have one more question here. Can you speak specifically to public health workers who have been behind the scenes but on the front lines since the get-go of the pandemic? What do you think can be done to help and support them?
So public health workers, yeah, well, kind of what we've talked about, right? They need to, at every level, right? Of the society. I mean, we need to acknowledge them in terms of the work that they're doing. We need to provide resources. We need to be appreciative of the work that they do. We need to also encourage them to take good care of themselves, which is a big part of today's message. I think I've been around helping professionals my whole career, and we're usually pretty awesome at taking care of other people, right? But not maybe so awesome at taking care of ourselves. So I think that's one of the key messages. It starts internally, And then organizations, if you're a supervisor or a manager, are you checking in with your people? Are you understanding, who has lost childcare, who has a mother or father or a sibling who died from COVID? Are you checking in on all that? Because that really is your role is to support your team and your colleagues on an organizational level too. I mean, you can do this in many, many ways.
That's great. Thank you. Thank you. Thank you so much, Dr. Van. This was really good. And I'm pretty sure we can all resonate with this information. And of course, gratitude is important because while all of this is happening, we still have to give gratitude for, the support system that we have and, having a job and whatnot. So thank you for this amazing presentation. This was really good.
Thank you, Kendra.
Of course. And thank you all for joining. And again, we've shared the presentation slides. If you have any questions, you can feel free to email me if you want the slides. And thank you again, everyone, for joining today.
You can also email me if you have other questions. Thanks, everybody. It's a real pleasure. And I'm grateful that we had this time to talk today.
Thank you. Take care, everyone. Bye.